health sector, this is the biggest difference. They're not data driven, or historically have not been data driven. If I go to fintech, you will see there's all these risk systems about how, because everybody's trying to prevent risk and fraud when transferring money. And they talk a lot, and they see different risk patterns, and they talk amongst themselves, and there's institutional knowledge, and the whole industry gets better over time because, if I can talk to you and you can talk to me and we can compare notes on what kind of risks we're seeing, we're both better off.
Yep.
But that same building institutional knowledge has historically not been there for health systems. In fact, the definition of getting a second opinion is a health system concept. You would go to a doctor and you would get their personal, expert opinion. Now, it's a considered opinion, it's a educated opinion, but it's their personal lived experience. It is not the opinion of this hospital based on everything that all the different primary care physicians have done and that we've researched, distilled, and turned into institutional knowledge, is that we should do this. It's based on my personal experience. And so people still to this day will fly across the country to find someone with the personal expertise that they're looking for. When was the last time you flew across the country to find a bank manager to get the best possible loan? Like, that doesn't happen, but it's, we're talking about similar amounts of money, like we're talking an impact on your life, but there's still this concept in the health system of, the considered opinion and getting a second opinion and finding the best person to do this rather than find the best institution,